This year on May 25, the World Health Organization reported that there were about 260 confirmed cases of monkeypox in 21 countries, which included the US, the UK, Canada, Australia, Germany, France, Italy, and also several other European countries. Now, as of June, around 3,200 cases of monkeypox have been reported from 48 other countries since January. Before this, there was also an outbreak in the year 2003 in the US, but the outbreak stopped there. Now, taking this as a concern, the World Health Network declared monkeypox as a case of public concern, which means that this outbreak is not limited to a single country or a region and should be addressed by immediate actions to prevent community transmission. So here the World Health Organization also had an emergency meeting yesterday to discuss about this matter on the monkeypox and how to contain it and how to go about with it. Here in this video we will be discussing more or focusing more on the number of cases, but let's get to know more about what monkeypox is. Now, what is monkeypox? Here is a detailed information on it. Monkeypox is a DNA virus which is in the orthopox virus family, and this virus is related to smallpox, but scientists say that it's not as dangerous as smallpox. It is a zoonotic disease, which means that it spreads from an animal to human. Plague, rabies, Lyme disease, these are also some of the diseases that can be transmitted from an animal to a human. So when a person first gets infected by this virus, one feels like it's like the flu, which comes with a body ache and then fever, swollen glands and rashes, which will usually appear on the face, and then it will start spreading to the other parts of the body. The rash produces flat lesions, which then fills up with fluid until the scalp falls off. When you get a burn, we get a bubble-like kind of a wound with fluid. It's similar to that. So most people recover from monkeypox within 3 to 4 weeks, but it is also said to be fatal. So now let's get to know more about how did the name monkeypox come about. It was first identified in 1958 in a lab monkey in Denmark, and that is how it got its name, monkeypox. But studies have shown over the years that the monkeys aren't the main carriers or the spreaders, but it is actually the rodents. So the World Health Organization has also suggested that changing the name, and now we'll talk about that later in the video. Coming back, it is believed that the types of animals that are bearing the virus and retaining it and also in the nature and are more likely to be rodents like tree squirrels, dormice or Cambrian rats. And also now let's talk about the history of the first human infection, how it first got infected from an animal to a human. The first case of monkeypox in human was detected in 1970 in the Democratic Republic of Congo. And now in parts of the Central and West Africa, monkeypox is endemic, meaning it is regularly found in those kind of places. When a disease is called endemic, it means that in those kind of areas, the disease is quite very popularly known and it's quite common. And now talking about the monkeypox, there are 2 strains of virus in the endemic regions in Africa, which is the Congo Basin strain and the next one is the Western African strain. Studies have shown that the Congo Basin strain is the more dangerous one, with mortality rate of about 11% in some outbreaks. And then the West African strain is less severe, which has about a mortality rate of about 1%. Reports also suggest that the current outbreak is linked to this strain. Now, monkeypox is found outside of the endemic region, and this is what baffled the scientists. For example, there was an outbreak in the year 2003 in the US, but what happened then was the disease was found on animals and humans that had traveled history to the endemic regions. Next, how does this monkeypox spread?
Monkeypox spreads through close, face-to-face, skin-to-skin, direct contact. This is how it's always been described. There may be some new things happening in this outbreak now. We don't know everything.
The virus spreads through close contact. That means the pox lesions, sores that occurs on the body contains fluids. And if the person who is not affected touches the wound of the sore or of the infected person, then they get infected themselves. And if there's a break in the skin, like I said, it comes like a bubble. So if there's a break in the skin, one can also get it indirect. That's how it gets infected.
thing about monkeypox is that it does cause a rash, which can be uncomfortable, it can be itchy, and it can be painful. So the most important thing about caring for someone with this illness is basically taking care of the skin.
One can also get infected indirectly, for example by sharing bed sheets, towels, and also any other types of clothing that touch the wound of the infected person. Third, it can also be transmitted by respiratory fluids like corona, like the infection person coughs or sneezes, but studies have shown that monkeypox is not as transmissible, which means that it wouldn't spread as easily as corona. Now, in the recent outbreak of the monkeypox virus in North America and Europe, the World Health Organization has said that the virus is primarily spreading through sex among men, with about 200 confirmed and suspected cases across at least a dozen countries. While the virus itself is not a sexually transmitted infection, which are generally spread through semen and vaginal fluids, the most recent surge in cases appears to have been spread among men who have sex with other men.
It's really important that all of us together make sure that the messages reach the people who need to have them right now. That is, people who may be at risk right now. And right now, those people are men who have sex with men or other ones who may be in contact with them, including family members.
Now, many diseases can be spread through sexual contact. You could get a cough or a cold through sexual contact, but it does not mean that it is a sexually transmitted disease, said Andy Seale, who advises the World Health Organization on HIV, hepatitis, and other sexually transmitted infections. However, what is to be kept in mind here is that the virus can be spread through close contact. And now monkeypox can spread through close skin-to-skin contact during sex, including kissing, touching, oral and penetrative sex with someone who has symptoms. Monkeypox rashes are sometimes found on genitals and in the mouth, which is likely to contribute to transmission during sexual contacts. Mouth-to-skin contact could cause transmission wherein the skin of mouth lesions are present. So here, it could be said that the spread of virus has nothing to do with the sexual orientation but the close contact. Now, can monkeypox be cured, or how can it be treated? In the present times, there is no treatment available for monkeypox. The good thing is that the monkeypox is in itself a self-limiting disease. That is, it gets better with time without the need of any treatment or medicines. However, certain vaccines are used to control the spread of the disease among the population. Since monkeypox and smallpox are so similar to each other, therefore currently the vaccines for smallpox are used to control the transmission of monkeypox. According to research, people who have already been vaccinated with smallpox are comparatively less prone to get the monkeypox. Also, other methods that help control the disease include vaccinia immunoglobulin, which is also known as VIG, and antiviral medications, which is used generally in the case of animals and not humans. Recently, a vaccine has also been approved in the year 2019 that is known to protect against both smallpox and monkeypox. However, the vaccine is still not available to the masses. Now, as mentioned earlier, we would like to discuss why did the World Health Organization decide to change the name of the monkeypox, or suggested on changing the name. So the decision to look into the new name or to change the name comes days after a group of 30 scientists from Africa and around the world called for changing the name. Scientists have raised concern that the name is discriminatory and stigmatizing. As I've mentioned earlier in the video, the World Health Organization classified the monkeypox into two strains, which is the Central African Congo Basin strain and the West African strain. So, in their paper, scientists argue that referring to the virus as African is not only inaccurate but it is also discriminatory. They also raised concern about an increasing narrative in the media that the current outbreak is linked to Africa by using those names. Scientists also pointed out that media outlets have used photos of African patients to report on recent outbreaks. This is concerning because, as I've mentioned earlier, the current outbreak was not just bound to Africa or the western part of Africa or the Congo region, but the outbreak was in the US, UK, Canada and places like that. So regarding this, the World Health Organization spokesperson has defended by saying that the monkeypox name came before the World Health Organization actually developed a guideline that recommends using not using geographic regions or animal names to define a disease or a sickness. And also World Health Organization Director Tedros Adhanom said that organization was working with partners and experts from around the world on changing the name of monkeypox virus, its clades and the disease it caused, while adding new names will be announced as soon as possible. So that's all the updates that we have for now, and as mentioned earlier, the World Health Organization held a meeting yesterday to discuss upon this matter and also to decide. The World Health Network has already declared this as a global concern, but again the World Health Organization held a meeting yesterday to discuss on this matter and to either declare this as a pandemic or a concern for the world. That's all we have for now. Keep watching Hornbill TV.